Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on one of the important topics and one of the most common diseases in women, that is vaginitis or vaginal infection or inflammation of vagina. These are all the same. We will look deep into it. The main problem with this disease is when the smell from vagina comes out. So she is embarrassed by this, and also she is not able to attend public places or public gatherings. The reason is her private parts are itching, they can be burning, and she tend to put her hand there and she's embraced of it, and she will not be coming into public places. One more difficulty the women face is having sexual relationship. When they are in a relationship or when they are married, they are afraid to meet the partner and they think that their partner may have some aversion towards them. This is also one of the common things we see, and we have seen where cases have led into breakups or they can be divorces because of this. One more issue we notice with this is this will be for a very long time. The reason is as this is not visible to the outside, and women tend to look into some YouTube videos or they Google it and they take own treatment, and this will last for a very long time, which leads into other complications. One more defect or one more important observation we have is this will come again and again. So if you are not treating it properly or if you're not taking care of it, it will come again and again. When you take antibiotics, so it will reduce for the time, and if the underlying pathology is not corrected, it will come again and again. It will be there for years together because women tend to fall in their regular activities and ignore this, or due to some other reason where it's not visible outside, so they tend to ignore it and they live with that for a very long time, which is not advisable. Basically, this is an inflammation of vagina or infection of vagina. They can be itching, redness, pain, and also there will be lot of discharge, that they call it as a leukorrhea or white discharge coming out of the vagina, and this is a very long-standing chronic disease sometimes. Coming to the signs and symptoms, with these signs and symptoms, you can identify that this is vaginitis. First one is color of the discharge. The discharge can be sometimes grayish in color, sometimes whitish in color, yellow or thick green to light green in color. There will be distinct smell. Some there will be a foul smell. Some express this as a odor coming from the fish, or it is a putrid meat. When the meat get rotten, so you'll get a smell. Even some describe that as a putrid meat or something that is rotting in the body. The female private parts will be lot of itching, or sometimes there will be burning pain, sometimes there will be normal pain, sometimes you will have blisters there or red rashes you will have, or it becomes sore and tender sometimes. These can be associated with fever. Sometimes they will not have fever. Both are possible. Some women will have pain while urinating. There will be severe pain, and also they can be bleeding from vagina in between the periods, or after the intercourse there will be a discharge of blood or discharge of mucus mixed with blood. One more important symptom is dyspareunia. Dyspareunia means there will be painful intercourse. The pain will increase just before intercourse, during intercourse, even after the intercourse. This is called dyspareunia. When you have these symptoms, you can confirm that it is vaginitis, or normally people will call it as leukorrhea or white discharge. Coming to the investigations, the most important investigation we do for it is examination of vaginal fluid. The vaginal fluid is collected and it is examined under microscope. There you can find some bacteria, you can find some fungus, and also you can find some protozoans there. With this you can infer that, and also other cells related to infection. With this you can infer this the vagina is infected or it is vaginitis. And also some other blood tests, like simple blood tests like CBP, complete blood picture, will give more information. And also C reactive protein will determine the amount of inflammation in your body. And the most important investigation we have to do is pap smear. The pap smear test is done by taking some small epithelial layer of vagina and examined under a microscope. The importance of this is we can rule out any precancerous condition or cancerous condition of vagina. So these are the common tests we do for vaginitis. In order to understand this disease completely, you have to have some knowledge about anatomy and physiology of female reproductive system. The private parts of the female, it is known as vulva. The vulva contains labia majora and labia minora. The space between labia majora and labia minora is vestibule. In vestibule, on the upper part there will be urethral opening, on the lower part there will be vaginal opening, and also you find some openings of vaginal glands or Bartholin glands. There will be vaginal opening. After the vaginal opening, it will lead into vagina. After vagina, there will be cervix. Cervix is the connection between vagina and uterus. Then you have the uterus. From uterus, there will be two fallopian tubules. At the end of fallopian tubule, you will have fimbriae, and after that you will have ovaries. This is the structure of female reproductive system. The important point to note here is entire inside of the vagina and cervix has some glands. We call it as vaginal glands. The important function of this vaginal gland is to secrete the vaginal fluid. Coming to the physiology of reproductive system from the perspective of vaginitis, the important thing you have to remember is the vagina and the cervix is lined by the vaginal glands. These vaginal glands secrete the mucus, and this mucus contains some bacteria, some fungus, and some protozoa. Normally, these are the commensals. Commensal is an organism which lives on other organism, but it will neither cause harm or doesn't produce any use. So there is no use and no harm when the two animals are associated. Here the two animals are human being and either bacteria, protozoa, or fungus. So there is association, but it is neither beneficial to both of them nor harmful to both of them. That we call as commensalism. So these fungus, bacteria, and some protozoans live in the vagina of the female as a commensal. The discharge coming out of from these glands is called vaginal discharge, or it is a leukorrhea or white discharge. So this is common in females. This is not pathological condition, and also the quantity of the fluid, color of the fluid, and odor of the fluid is distinct from women to women. Within the women, depending on her age and also which stage of the menstrual cycle she is in, this also varies. Normally the pH of this vaginal fluid is 3.8 to 4.5. It is slightly acidic. Normally it will be clear, it will be transparent, and relatively odorless. And also some bacteria, that is lactobacillus, not only in our abdomen, it lives in the vagina of the female as well. This is lactobacillus. Why do women need this fluid? What are the uses of this fluid? It keeps the vagina clean, and it makes the vagina moist, and also it helps as a lubricant when there is sexual intercourse. It prevents the infection, vaginal infections, and also it prevents the accumulation of dirt. It is an important pH balancer within the vagina of the women, so that the sperm can stay alive, and it goes into cervix. From there it goes into uterus and fertilizes in the fallopian tubule. So it is important for sperm motility as well. Depending on the menstrual cycle or ovarian cycle of the women, so the thickness of this fluid, the color of the fluid, the quantity of the fluid differs. What happens is immediately after the menses is stopped, the quantity of vaginal fluid is medium. It is not either too small or too high. It will be medium quantity, and it will be whitish in color, and it will be thick, and it will be milky. As the days passes and it reaches the ovulation, around ovulation or 14th day of menses, it becomes loose, it becomes more in quantity, it becomes transparent, it becomes sticky. This helps if there is an intercourse and deposition of sperm in the female. So this helps the sperm to move into the cervix, where it get fertilized in the fallopian tubule. That's the reason around ovulation there will be higher amounts of fluid coming out. It will be transparent, it will be thick, and it will be loose as white of the egg. Once this phase is completed and moving towards the end of the menstrual cycle or end of the ovulation, the amount of vaginal fluid becomes small, the quantity of the vaginal fluid becomes less, and also it becomes thick, it becomes curdy white, and it becomes white in color. The average amount of vaginal fluid coming out will be a teaspoonful. In some women, what happens is it goes up to 30 times more. With this, it can go up to 30 teaspoons. This is all normal, and this is not abnormal. This is all normal in a healthy women. And there are some conditions where the amount of vaginal fluid or white discharge increases. First one is menarche. Around menarche, or when the girl is going to get matured, at that time she will get a bit higher amounts of vaginal fluid. This is all normal, this is not abnormal. And also during sexual arousal, when the woman is sexually aroused, there will be lot of vaginal fluid coming out, and this is also normal. In some women, what happens is after the intercourse, immediately after the intercourse, there will be copious amounts of vaginal fluid coming out, and this is also normal. And even during pregnancy, some women have a challenge that there is a lot of vaginal discharge coming out, and also this is also physiological. There is nothing wrong in it. So whether it is during menarche or sexual arousal, immediately after sexual intercourse or pregnancy, these are all normal, and there will be bit higher amount of vaginal fluid coming out. And coming to the myths, there are several myths around this vaginal fluid. First one is backache. Women think that if they have lot of discharge or vaginal discharge, it will lead into the backache, but this is absolutely wrong. There is no connection between vaginal fluid coming out and the back pain. These are all completely independent, and it doesn't depend on it. And next one is weakness. Some women think that if there is excessive discharge, they think that the body becomes weak, their immune system decreases, or the immunity is decreased, and they will land into lot of issues. This is also not true. If even there is a lot of vaginal discharge coming out, it doesn't lead to any weakness unless there is any other pathology within the women. And bleaching of the panty. Some women think that when their panty bleaches, the color of the panty changes. They think that there is some abnormal thing going in her vagina or in her body. This is also normal, because when you compare to other fluids, vaginal fluid is slightly acidic. The pH is from 3.5 to 4.8. That's the reason it is slightly acidic, and when the vaginal fluid falls on the panty, so it changes the color. This is also normal. And one more common myth is, in some women what happens is, immediately after the intercourse there will be lot of vaginal fluid coming out. With this, the women think that after the intercourse, under ejaculation is done, they think that the sperm is not reaching the uterus, or it is not reaching the fallopian tubules. It is coming out after the sexual intercourse, and they are not able to conceive because of this reason. It is not true. Even after sexual intercourse, when you have higher amounts of vaginal fluid coming out, it is actually beneficial. It helps the sperm to swim through the cervix and reach the fallopian tubules through uterus, and basically this helps more in conceiving. It is not against conceiving. So these are all myths. You should be keeping all these points in mind, that these are all myths. There is no scientific proof for this allegation. And coming to the etiology, what is the reason for this vaginal infection? First one is, there can be bacterial infection, there can be viral infection, fungal infection, or protozoal infection. There can be different type of infections, and also there can be mechanical or chemical injuries. So these are all the reasons for it. First one is diabetes. Diabetics have more at risk of getting this vaginitis. If a woman is using birth controlling pills, it is also one of the major risk factors. And coming to prolonged use of antibiotics, if for any reason, if you are using antibiotics for a long time, this is also one of the reasons for vaginitis. Some vaginitis, there is no cause, we call it as unknown cause. And also some other reasons are douching. Douching means washing the vagina again and again, more than 2 to 3 times a day. This can also induce some injury into the vaginal area, and this can lead into vaginitis. And also, because of excessive smoking, there can be vaginitis. And also, when you have new sexual partner, or when you have multiple sexual partners, and when you have STD, sexually transmitted diseases, you also will have more pathological forms of white discharge or vaginitis. So there are some conditions where you can land up into some STDs when you exchange towels, or when you exchange bathing suits with other women. And also some cancers or precancerous condition can produce excessive vaginitis and excessive discharge. And also old age, because of the hormonal changes in the old age, there can be vaginitis and excessive discharge of vaginal fluid in a particular woman. So these are all the risk factors and causes for vaginitis or white discharge. And coming to the pathology, what are the changes that can be observed in the body of a woman when she has vaginitis? So this is pathology. The first variety of vaginitis is bacterial vaginitis. There is a bacteria by name Gardnerella vaginalis. This is one of the commensals which lives in the vagina of women. Sometimes what happens is its number increases, or the amount of bacteria in the women increases, then this will lead to vaginitis and also white discharge. In this, the discharge is grayish or whitish in color, and when the smell here is distinct, the smell is foul, and also it is fishy discharge. It is fishy odorous. When the woman gets the vaginal fluid, the smell of vaginal fluid as fishy, it is mostly due to bacterial vaginitis. There can be itching, and there can be irritation also in the private parts. The reason for this is mostly unknown. And also women that smokes more are at high risk of having this vaginitis. And also when the woman has a new sexual partner or multiple sexual partner, she can land up into this disease. And also douching means if you are washing the vagina more than once a day, or several times a day, this is known as douching. And in such women also we can see this bacterial vaginitis or bacterial vaginosis. Next form of bacterial vaginosis is gonorrhea. This is a sexually transmitted diseases. This is caused by the bacteria Neisseria gonorrhoeae. The distinct feature in this disease is there will be copious amounts of white discharge, and also there will be painful urination. Urination is painful in this women. And coming to the next variety of vaginosis, that is fungal vaginosis. Here the causative organism is Candida albicans. The discharge here is thick, lumpy, it is creamy, and it looks like a curd. And also the women will have itching, there will be irritation, there will be redness of vulva, and also dyspareunia. Dyspareunia means there will be painful coitus, or intercourse will be painful. Some of the common risk factors for this is diabetes and prolonged use of birth control pills, prolonged use of antibiotics, and also stress. If the woman is in stress for a very long time, she can land into fungal vaginosis. And the next one is protozoal vaginitis or vaginosis. Here the causative organism is Trichomonas vaginalis. This Trichomonas vaginalis is also a commensal. It lives normally in the vagina of the female. Due to some abnormal things or changes in the body, the load of this protozoans will increase in the women's vagina, and that leads to this disease. The distinct features here are the discharge is yellow in color or white in color, and also it is frothy. It is frothy discharge and also putrid smelling. It smells as if something is rotting or the meat is rotting. There will be the external female private parts here are painful. They can become red, they can become tender as well. This is an STD, sexually transmitted disease, and this can also spread through sharing of towels or bath suits. The important thing here to remember is men will also have this commensal within their body. They act as carriers. They will not show any signs and symptoms. When they go and have an intercourse with the women, that women can show the signs and symptoms. And also some women are also act as carriers. Even some women will not have any symptoms if they are infected by this organism, and it is asymptomatic both in women and men. It is asymptomatic in most of the men. It is asymptomatic or it is without symptoms in some women. Next type is viral vaginitis. It is mostly genital herpes. This is caused by the virus herpes simplex. Here there will be excessive discharge, and also there will be painful. The external genitalia or female private parts are painful. They can be blisters and they can be heavily itching. When you have these symptoms, it can be due to viral vaginitis. It is due to herpes simplex. There can be vaginitis because of chemical and mechanical irritants. Mechanical irritants will be like having multiple sexual partners, or you are indulging in sex several times a day. And also if you are undergoing douching means washing the vagina again and again. If you are applying some perfumes, or you are washing regularly, and also if you are using some chemical lubricants, these also can cause mechanical or chemical vaginitis. And coming to atrophic vaginitis, this is one of the common vaginitis we see in elderly women. Here what happens is after you reach the menopause, there will be less amount of estrogen in your body. Because of less estrogen, the inner lining or inner mucosal lining of vagina will get atrophied or becomes thin, and this can lead to the pain of vagina, and also there will be some discharge. This is known as atrophic vaginitis. And also next type of vaginitis is due to pre-cancer and cancerous conditions, or also when there are some polyps in the vagina or cervix of the women, it can lead into this vaginitis. They can be brown color discharge or blood stained discharge coming out from the vagina of the women. This is due to polyps, cancers, or precancerous conditions of vagina. And coming to the conventional treatment, conventional treatment is the treatment when you have vaginitis or pain in vagina or white discharge. You go to a gynecologist or a private hospital or a corporate hospital. The treatment given by them is conventional treatment or English treatment or Western form of treatment. The problem with them is they will use either antibiotics or antivirals or antiprotozoals or antifungals. These are all the medicines like antibiotics. They have a lot of side effects, and the main problem with them is when the underlying cause is not removed. If you are just using antibiotics superficially, this will come again and again. This is the main problem with them. And also they will use a lot of antihistamines to reduce itching. These histamines have a lot of side effects, like it will disturb your sleep and also have some other side effects. Coming to the painkillers, when there is severe pain, they will also use painkillers. So these painkillers have a lot of side effects, like they can damage your kidney, they can damage your liver, and they can damage your nervous system. So there is no proper treatment in allopathy for it. Even if you take all these things, there will be recurring vaginal infections again and again. These are all the common problems we see with conventional treatment. And coming to the homeopathic treatment, homeopathy offers you the best treatment. What happens here is you can completely cure your vaginal infection, whether it can be due to bacteria, or it can be virus, or it can be fungus, or it can be any protozoal. You have the best treatment in homeopathy. You can completely reverse the pathology, and also you can ensure that this disease is not coming and again. You can cure it, you can prevent it, and also ensure that all this cure or prevention is without any side effect. You cannot have even one side effect with homeopathy. You can have permanent cure, and also all of this is with less amount, or all of this is with within the budget. So homeopathy is not costly, it doesn't have side effects, it is very safe. And when you take the constitutional treatment in homeopathy, it ensures that the complications are prevented. Sometimes these may land into cancers. Even in homeopathy, there are medicines that if you take constitutional homeopathic treatment, you can ensure that you are not landing into complications as well. And coming to the precautions, what are the precautions you have to take when you have this disease? First one is, you should not be cleaning your vagina more than once a day. And if you are not at all cleaning it, you have to clean at least once a day, and you have to use mild washes to it. If you are washing it again and again, the useful bacteria in it dies, and it can lead into infection. This is the first one. And the second one is, do not use any chemical or mechanical irritants like deodorants, perfumes, sprays, or feminine washes. Do not use all of this. Be natural always. You have to ensure there is sufficient sexual hygiene, and you can encourage your partner to wear condom, or you can wear a female condom. And also be aware of the sexual past or sexual history of your partner, so that you have to have sufficient precautions for it. Always use breathable and undergarments made of cotton, so that there will not be much irritation in that area. Try to avoid antibiotics as much as possible. If you are on long term use of antibiotics, you have to take probiotics as well. And the important thing is, do not take self treatment anytime. Reach us, and we will help you in clearing your disease. And coming to other precautions, you always have to have a healthy diet. The diet is very much important. Have regular exercise, lead a stress free life, and also ensure that you have sufficient sleep, so that your immunity is optimized and you will not land into all these kinds of diseases. And what happens if you neglect this disease? What happens is, this may rarely turn into cancer. So this vaginitis, you can go into pre-cancerous or cancerous condition. It can also lead into permanent or temporary infertility. You are not able to conceive because of it. And also one more disease is pelvic inflammatory disease. From vagina, the inflammation can spread into other parts of the female organs, and it can lead into pelvic inflammatory disease. We are Fidicus Homeopathy. We are located in Manikonda, Hyderabad. We offer you two kinds of treatment. One is online treatment. Wherever you are in this world, you are out of India or within India, or if you are in Telugu speaking states, we can provide you online consultation for you. We will take the case online. We will get your reports, and we will ship the medication to your doorsteps. You can use them and report and get it cured accordingly. And also you can come to us directly for face to face consultation. Thank you.